It hasn't been thought of as a technological material, and so we tried to see if there are possibilities in which silk could replace glass, could replace plastics, could replace some of the supports for semiconductors. And so what are the applications in optics and electronics and some of these things? But it's not only for the applications of optics and electronics. Now you have a material that actually does multiple good things in multiple fields. So you can have optics and electronics now that integrate with your human tissue because silk is implantable, or you can have optics and electronics that you can eat because silk is consumable. And it's a pure protein, and the processing is green, and it's all done in water, and so it's a sustainable fabrication process. So there are very many avenues in which this whole platform could be quite disruptive, we think. And I think that as usual, it almost seems like the good things always lie at the intersection of different fields. It happened by chance, with a conversation with David Kaplan, who is the initiator of actually thinking about silk in a different way. And I saw for the first time a little piece of transparent silk, and I had no idea that was silk. And so we started asking questions, and then we started trying out things. And as we started trying out things, things worked, and so we continue to play. I mean, it's a lot of fun. You can use it for health because of the capacity of silk to reintegrate in the body, and you can use it for the environment because it's a protein that will eventually melt away, and so it's not it doesn't feed back harmful substances back in the environment. So there's in fact there's a ton. So we work on optics in silk because we think that there's an opportunity in putting optics inside tissue so that you can see tissue better. So for instance, we work on mirrors that will integrate in tissue and make tissue more reflective so you can see it. Even in hard to see regions, and I think a lot of the optics, for example, that can dissolve can be interesting to make for example things that are safe to integrate with catheters or other instrumentation that you have in the body, so that if you lose an optic, say for example, it doesn't cause you any harm, as if you would say if you lost an optic made of glass. We're actually trying to get a little disc of silk and actually replace cornea without having to harvest the cornea from cadavers, for example. And on the lens side, I mean, in principle, there's no reason to think why you couldn't do it. It just becomes a little bit tougher to get the right implant. I think the key is that you either have something that reintegrates in the tissue or allows for your native tissue to reform around what you implant. So the implant acts as a scaffold, basically. This is the paradigm of tissue engineering. You put the appropriate scaffold, you seed the appropriate cells, and then the cells use the scaffold to rebuild something that you don't have anymore. And so there are challenges in making something that is transparent, that has the right curvature, and have the right features. I mean, in principle, anything's possible. In fact, the person that we collaborate at University of Illinois, John Rogers, is very famous for doing flexible electronics. And so basically, like these things that you can put on a piece of rubber, and you can stretch the electronics and they still work. And so one of the things that they're trying to do is they're trying to make a camera that is, instead of having, say, a flat field of view, a flat sensor where you record the image, has a circular sensor where you record the image, kind of like the retina in your eye. So they're doing some amazing things in putting CMOS chips on bendable substrates and actually do these curved sensors that are going to be eventually potentially very interesting from an image quality point of view, and reducing aberrations and image distortions and things like that. So more bio inspired. For the cornea implant, I think that we're going just through a bunch of animal testing, and it's going to continue with animal testing and clinical trials eventually. I mean, it's progressing. These things are not immediate, because as in anything medical, you have to go through a process of approval, you have to go through a process of validation and certification before you're actually and verify that everything is safe before it actually goes into use, right? To me, this is just the first step. As a lot of this work is really finding the people that connect. I'm very happy that this is starting to that this is starting to attract the attention of the public at large. But I think that there's more that is to come from bringing each person's competences in one place and in one material.